What if the first warning sign of a serious health problem wasn't chest pain, but a change in your erections? I've seen it happen more often than you'd imagine. Men who brush it off thinking it's just stress or age, until one day they're sitting in my office terrified by what their body is trying to tell them. For years, I've treated men who waited too long, men who ignored the quiet signals their bodies were sending. What many don't realize is that the penis is often the body's earliest alarm, a messenger of your heart, your blood flow, your hormones, even your mental health. When something goes wrong there, it's rarely just about sex. It's about your entire system calling for help. That's why today I want to share 10 things men do often without thinking that silently harm their penis and their overall health. Some are habits so common you might not even notice them. Others are mistakes that start small but end in my emergency room. If you care about staying strong, confident, and healthy for years to come, stay with me until the end, because the last one on this list is the most surprising of all, and it's one that every man needs to hear. When a man starts losing morning erections, most shrug it off. It's stress, they say. I'm just tired. But I've learned after years in urology that the penis is often the first organ to whisper what the rest of the body is screaming. It's not just about performance, it's about circulation, nerves, and hormones working in perfect rhythm. In fact, research from the Journal of the American College of Cardiology found that men who develop erectile dysfunction are 40% more likely to experience a heart attack or stroke within 5 years. The arteries in the penis are smaller than the ones feeding your heart. That means they clog first. When blood flow weakens there, it's often a sign your cardiovascular system is under silent attack. I remember one patient, mid-50s, healthy on paper, no smoking, good diet. He came in thinking he just needed a little blue pill. Instead, his tests revealed severe plaque buildup in his coronary arteries, a heart attack waiting to happen. His penis saved his life because it forced him to get checked. So when you notice changes, fewer erections, weaker response, slower recovery, don't hide behind embarrassment. Your body is talking. Listen before it has to scream. Because here's the truth, ignoring early warning signs doesn't make them disappear. It just gives disease more time to win. And if turning away from the problem is dangerous, trying to fix it yourself can be even worse. And that's where most men get into real trouble. When men finally admit something's wrong, many still take the most dangerous shortcut. They try to fix it themselves. After all, the internet is full of promises. Grow it naturally. Use this oil. Try this secret stretch. But what you don't see are the emergency room visits that follow those so-called miracle hacks. I've treated men who poured vinegar toothpaste, even herbal mixtures on their genitals, convinced it would detox or increase size. One patient once wrapped a homemade metal ring around himself, thinking it would trap more blood and keep his erection longer. We had to call the fire department to cut it off. He nearly lost his penis that night. These aren't isolated stories. In 2023, a review in the International Journal of Impotence Research reported a sharp rise in penile trauma linked to online DIY enhancement methods. The truth is simple. There's no cream stretch or potion that can safely make your penis longer. What these methods do make longer are the lines in my emergency department. I get why men fall for it. The fear of losing masculinity runs deep, and desperation makes anything sound believable. But the penis isn't a gadget you can tweak at home. It's a complex organ made of delicate vascular tissue. Once it's scarred or damaged, that injury can be permanent. So before you try anything you saw in a late-night ad or a YouTube life hack, Remember, this real change doesn't happen in your bathroom. It happens in your bloodstream, your hormones, your habits. And that brings us to something far simpler, but just as overlooked: hygiene. Because sometimes the biggest problems start not from what men do to fix their penis, but from what they forget to do to clean it. After seeing what men sometimes do to fix things, you might think the simple act of cleaning would be the safest part, but that's where many go wrong too. I can't count how many infections, rashes, and painful inflammations I've treated that started with nothing more than over-cleaning or neglect. Here's what most men miss: the skin of the penis isn't like the rest of your body. It's thin, sensitive, and designed to protect itself with a natural balance of oils and bacteria. When you scrub too hard, use harsh soap, or blast it with scented body wash, you strip away that protection and open tiny micro tears that invite infection. One of my patients, a man in his early 40s, came in complaining of burning and redness that wouldn't go away. He was using an antibacterial soap twice a day because he thought more was better. What he really had was chemical irritation, so severe it mimicked a fungal infection. When he stopped overcleaning, it healed on its own within a week. On the flip side, neglect can be just as damaging. For men who are uncircumcised, failing to pull the foreskin back and rinse gently underneath can lead to a buildup of smegma. That's the white, waxy residue that traps moisture and bacteria. Left alone, it can cause balanitis, scarring, even make it impossible to retract the foreskin later in life. A simple rinse with warm water and a mild, fragrance-free cleanser is all most men need. Dry the area well gently, not aggressively, and you've done more for your health than any expensive product ever could. Clean doesn't mean sterile. It means balanced. And balance is the key to everything down there, from hygiene to blood flow, and especially when it comes to pain. Because what men often ignore next isn't just discomfort, it's the early warning sign of something far more serious. Cleanliness protects you, but awareness saves you. Pain, swelling redness, or a sore that won't heal is your body's emergency flare. Yet, too many men ignore it, hoping it'll just go away. I've watched small, treatable infections turn into conditions that steal both function and confidence simply because someone was too embarrassed to ask for help.
Thank you, doctor.
I once treated a man in his early 60s who'd had a tiny ulcer on his penis for months. He covered it with tissue, convinced it was just irritation. By the time he came to me, it wasn't irritation, it was early-stage penile cancer. Caught late, it can spread quickly and require surgery that changes a man's life forever. But caught early, it's highly curable, often with minimal intervention. Pain or bleeding isn't a men's badge of toughness, it's a symptom. A burning sensation when you pee could mean a urinary tract infection or a sexually transmitted infection. Blood in the urine might point to kidney stones or, in some cases, bladder cancer. And that dull ache or curvature during erections, sometimes it's Peyronie's disease, a buildup of scar tissue that worsens if left untreated. Ignoring your body's distress signals doesn't make you strong, it makes you vulnerable. The smartest men I know are the ones who act fast, not the ones who hide their fear. If you ever feel judged, find another doctor. A good physician doesn't shame you, she helps you, because the longer you wait, the more you lose. And not just physically. Pain that lingers becomes fear, and fear eats away at intimacy. That's why taking control of your sexual health isn't just about medical tests, it's about safety, trust, and presence. And that same sense of control matters just as much when it comes to protection in every sense of the word. Because the next mistake men make isn't about ignoring danger, it's about underestimating it during sex. After years of treating emergencies that began as just a little pain, I can tell you this: the next danger often starts in the heat of the moment. Sex should never feel like a gamble with your health, and yet so many men forget that safety and control are what actually make intimacy better, not weaker. When you protect yourself, you protect your freedom. Using condoms isn't just about preventing infections, it's about letting go of fear. When you're not worried about STDs or unwanted pregnancy, your body and mind can relax. That's when genuine connection happens. I've seen it in countless couples when safety is a given. Performance anxiety disappears almost instantly. But protection isn't only about condoms. It's about staying in control. During passionate sex, one misplaced thrust, one sudden twist can cause what we call a penile fracture. And yes, it's exactly as bad as it sounds. You hear a pop pain hits like a lightning bolt, and the swelling turns the penis deep purple, what doctors call an eggplant deformity. It's a surgical emergency. If not repaired immediately, half of men develop permanent erectile dysfunction. One of my patients, mid-30s, came in pale and shaking after a night he'd rather forget. He thought the pain would fade. It didn't. It worsened every hour until surgery was the only option. Months later, he told me what haunted him most wasn't the injury, it was how easily it could have been avoided. Control isn't unsexy, it's powerful. Hold your partner's hips, guide the rhythm, and pay attention to your own body's limits. And if something feels off, stop. Real intimacy isn't about proving stamina. It's about mutual awareness. And speaking of awareness, there's another kind of heat men rarely think about, one that doesn't come from passion, but from the environment around them. Because while heat can ignite desire, it can also silently destroy fertility. Heat gives life, but too much of it can quietly take it away. I've seen men who treated their testicles like any other part of the body, never realizing how fragile that temperature balance really is. The testicles live outside the body for a reason. Sperm production depends on staying just a few degrees cooler than your core. Raise that temperature for long periods, and the factory starts shutting down. Studies from Harvard and the Cleveland Clinic show that repeated exposure to high heat hot tubs, saunas, even laptops resting on the lap for hours can reduce sperm count by up to 40% and temporarily lower testosterone levels. It doesn't always cause permanent damage, but over time, those small thermal hits can add up. I still remember a patient, early 40s, who couldn't understand why his fertility tests kept dropping. He didn't smoke, didn't drink, but he worked remotely with a laptop pressed against his thighs 8 hours a day. Once he switched to a desk setup and cooler environment, his numbers rebounded within months. Sometimes the fix is that simple. If you regularly soak in hot baths, hit the steam room after every workout, or keep your phone in your front pocket all day, you're bathing one of your most sensitive organs in slow burn heat. The solution isn't to fear warmth, it's to give your body room to breathe. Looser boxers, cooler showers, breaks from sitting, and a little awareness go a long way. Because maintaining a healthy temperature isn't just about fertility, it's about preserving the hormones that keep you energized, focused, and alive. And speaking of habits that can quietly rewire those hormones, the next mistake isn't physical heat, but the kind you create with your own hands. The kind that starts innocent and ends in numbness. The heat I see next doesn't come from steam or sunlight, it comes from friction. Many of my patients are surprised when I tell them that the most common cause of numbness and sensitivity loss in the penis isn't disease, it's habit. Specifically, the way they masturbate. I've had men tell me they grip so tightly they lose all feeling afterward, or that they need intense pressure just to get aroused. What they don't realize is that the penis isn't built for that kind of force. The The skin nerves and blood vessels are delicate, designed for movement and rhythm, not crushing pressure. Over time, that death grip trains your brain to only respond to unrealistic intensity. Then when you're with a partner, nothing feels the same. In clinical terms, it's called desensitization, the nervous system adapting to overstimulation. MRI studies from the University of Montreal found that men who engage in frequent high-pressure masturbation have altered reward responses in the brain's dopamine circuits, similar to what happens in other addictive behaviors. It's not about guilt, it's about physiology. One patient in his late 30s told me he thought he was broken. He couldn't maintain an erection during sex, yet was perfectly fine alone. Once he changed his habits, slowing down, using lubrication, and focusing on sensation instead of speed, his body relearned what natural arousal feels like. It took time, but it came back. Masturbation isn't the enemy. It's how you do it that matters. Use lubrication, relax, treat it as an experience, not a race. Your body deserves gentleness, not punishment. Because what affects blood flow and nerve response doesn't stop there. The next danger is something far more toxic, and it doesn't start in your hands, it starts in your lungs. I've lost count of how many times I've said this in my clinic. If you smoke, you're not just harming your lungs, you're strangling your erections. Every cigarette narrows your blood vessels, cutting off oxygen and blood flow to the places that need it most. The arteries that feed the penis are tiny, and nicotine makes them tighten, harden, and clog faster than any others. Studies from Johns Hopkins and the Mayo Clinic show that smokers are twice as likely to develop erectile dysfunction compared to non-smokers. It's not instant, it's silent, creeping damage that builds with every drag. The same chemicals that cause heart disease also stiffen the smooth muscles that control erection. Over time, the body forgets how to expand those vessels properly, and what was once effortless becomes impossible. I once treated a patient in his late 40s who had been smoking since high school. He thought quitting was hopeless, but 3 months after he stopped, his morning erections began returning. By 6 months, his blood flow had improved by nearly 30%. That's how resilient the human body can be when we stop attacking it. And smoking is just the beginning. The same oxidative stress that damages the arteries also hits the bladder and kidneys. I've seen smokers with aggressive bladder cancers, and the hardest part is that many of those cases were preventable. Your penis is connected to every other organ through one single system circulation. When you care for your heart, you care for your erections. When you move your body, eat better, sleep enough, you're not just living longer, you're living fuller. That's why I tell my patients this isn't about vanity, it's about vitality. Because even with perfect habits, one thing can still sabotage all your progress, and it lives quietly in your mind. The next mistake men make isn't physical, it's emotional, and it's one of the hardest to heal. After years of treating the physical side of male health, I've learned that the mind can wound just as deeply as disease. Stress is invisible, but its fingerprints are everywhere in hormones, in sleep, in the quality of erections. I've seen men whose bodies were perfectly healthy, yet their anxiety alone was enough to shut everything down. When a man experiences one failed erection, his brain remembers the fear, not the moment. The next time he tries again, that memory replays like a warning siren. What if it happens again? And the body, flooded with cortisol, obeys the panic instead of desire. It's called performance anxiety, but I call it a feedback loop. The more you fear, the more it feeds itself. One of my patients, a 52-year-old teacher, told me he avoided intimacy for months after one bad experience. His blood work was perfect, his heart fine. What he needed wasn't medication, it was permission to forgive himself. Once he stopped seeing every encounter as a test, his confidence and his function returned naturally. Science backs this up. Studies from the University of Chicago show that chronic stress lowers testosterone and disrupts the brain's sexual response pathways. In other words, the harder you push yourself to perform, the more your body resists. So be kind to yourself. You are not a machine. Desire ebbs and flows, and that's part of being human. If you stumble, it doesn't define you. Talk to your partner, breathe, laugh about it if you can. That's how you break the cycle, because here's the paradox I've seen again and again. The moment a man stops obsessing over control is the moment his body starts working again. And that's exactly what leads us to the final truth, one that every man over 40 needs to hear. It's not a scare tactic. It's biology's quiet rule. Use it or lose it. There's a saying in medicine that's brutally simple, but absolutely true. The body protects what it uses and abandons what it doesn't. That applies to the penis more than most people realize. When men stop having regular erections, whether through sex or even nighttime arousal, the tissue begins to change. Blood flow weakens, oxygen drops, and the smooth muscle fibers that once stretched easily start turning into scar tissue. I've seen it in men who gave up intimacy after years of stress or illness. They told themselves it didn't matter anymore. But within months, their erections became weaker, shorter, and less responsive, not from aging, but from inactivity. The body had simply stopped prioritizing what it thought they no longer needed. Normally, healthy men have 3 to 5 erections every night while they sleep. These aren't random. They're maintenance, nature's way of keeping blood oxygen moving through those tiny vessels, preventing atrophy. When that stops happening, it's a red flag. It means something deeper, cardiovascular, hormonal, or emotional needs attention. But here's the good news. The system is remarkably responsive. Regular sexual activity, whether solo or with a partner, keeps those pathways alive. It boosts testosterone, supports circulation, and strengthens the pelvic floor. Even non-sexual intimacy, touching, kissing, affection, sends signals that reinforce connection and vitality. One of my patients, a 67-year-old widower, once told me he thought that part of his life was over. After counseling hormone therapy and simply learning to reconnect with his own body, his confidence and his erections returned. Not because of a miracle pill, but because he gave his body permission to live again. Sex isn't just pleasure, it's physiology. It's the body's way of maintaining itself, of reminding you that you're still alive and connected. Ignoring that part of yourself doesn't make you stronger. It makes you smaller in every sense of the word. So use it. Keep that part of your life active, open, and healthy. Because when you nurture it, it doesn't just sustain your body, it feeds your spirit. And as I always tell my patients, at the end of every visit, your sexual health is not separate from your life. It's proof that you're still living it. So if there's one thing I hope you take from this, it's that your sexual health is never just about sex. It's about your circulation, your hormones, your confidence, and the way you show up in your own life. Every signal your body sends, from morning erections to small changes in sensitivity, is part of a bigger conversation about your overall health. Don't wait until something breaks to start caring. Take small, consistent steps. Now move your body, eat real food, get enough rest, and pay attention to the signs your body gives you. And most importantly, talk about it. Ask questions, get help early. That's what real strength looks like. I make these videos because I know how hard it can be for men to get honest, science-based information about their bodies without judgment or shame. If today's video helped you understand yours a little better, then my job is done, but your journey is just beginning. So, before you go, do me a favor, hit that like button, subscribe, and turn on the notification bell so you never miss new insights on men's health, vitality, and longevity. And if you found something in this video that made you stop and think, save it or share it with someone who might need it too, because these conversations save lives more often than you'd think. Tell me in the comments, which part surprised you the most today? The one you never thought could affect your sexual health? I read your stories, I listen, and I care. Take care of your body, take care of your mind, and remember your health isn't just about living longer, it's about living better.